everyone, welcome to AFA Limb Lengthening team. This is Özlem from AFA Limb Lengthening team. I'm the manager of the team, and we would like to have our surgeon, Professor Dr. Mustafa Uysal, with us to answer some of our questions which are frequently asked. Hello doctor, welcome.
Hello, thanks.
My first question is, why the circular frames are recommended for tibias instead of the monorail fixators?
Let me explain that. Upper and lower legs are completely different than each other, so they need different approaches. Thigh has only single bone called femur. Monolateral fixator systems are proper for femoral lengthening. However, leg has two bones such as tibia and fibula. Mechanical loads on tibias are different than femurs. There is no muscular tissue on anteromedial side of tibia as well. You can easily feel the bone structures under your skin by touching here. When you apply distraction on tibia during lengthening, the gradually increasing resistance occurs on the lateral side of the leg. So tibia tends to have valgus deformity. In order to avoid these complications, both bones need to be controlled circumferentially at the same time. Monolateral fixator may not be sufficient to control loads on tibia, so I found the circular frames is superior to monolateral fixators for tibial lengthening.
Thank you, Professor. So my second question, how should be the general osteotomy done?
This is an important point. First of all, every kind of osteotomies should be done very precisely with minimal invasive technique in limb lengthening surgery. Every soft tissue structures must be preserved carefully. Bone should be cut at appropriate level with special instruments. I use for that the multiple drilling techniques, which is safer and friendly to the bone.
Thank you. And yes, we have another question which has been asked by many patients recently. So here is my question. We know 8 centimeters and 6 centimeters lengthening rates are the maximum safe limits, respectively for the femurs and the tibias. But what is the main reason for that? What happens on the individuals if they exceed these safe limits?
I did not invent these numbers. The literature gives us these safe limits. There is an optimal ratio between risks and benefits. After these safe limits, risk ratio increased too much. When safe limits are exceeded, excessive tension in soft tissues may cause various complications and permanent decrease in physical capacity. It can also interrupt the callus formation of the bone. If you follow up the path without crossing the borders, you will reach the goal safely and it will give the best results for your patients. Safety is first every time.
Okay, indeed. Why exactly the daily lengthening rate should not be more than 1 millimeter per day?
According to our experience, average 1 millimeter per day is optimum amount for lengthening. Soft tissues such as nerves, muscles, vessels, tendons, and ligaments can adapt the best in that rate. That's why I prefer 1 millimeter lengthening per day, but I adjust the rate according to my patient's conditions. Sometimes this rate may be 0.75 millimeters for tibial lengthening. Okay,
thank you, Professor. And another question. I see, and the other patient candidates, they see many patients who underwent the surgery with LON method can walk without any type of supports, both during their lengthening period and just after the fixator removal. But we know you do not let your patients to walk without any supports. I wonder, and I believe there are many people out there, they wonder too, if the fixator and the solid nails inside are enough weight bearing, why exactly you do not let them walk without any support.
We know that current fixator systems that we use very rigid and strong. They can easily resist to patient's weight. But the weakest point of these systems is the connection interface between pins and the bone tissue. Full weight bearing affects negatively this interface and may produce micro movement here. We know that micro movements facilitate the occurrence of infection. In order to avoid loosening an infection, I generally restrict full weight bearing during the lengthening period.
Thank you, Professor. Here's my last question for today. What are the most important steps in limb lengthening surgery?
Limb lengthening surgery has 3 important steps: planning, surgery, and follow-up. These 3 steps are very crucial and closely related to each other. One cannot be fully completed without the other. Detailed and correct planning makes the surgery easier. Meticulous surgical techniques increases the success rate and reduces the risks. Regular follow-up periods keep the surgeon awake against the complications before it's too late. All is necessary for success. I always try to give my best to my patients.
Well, thank you so much, Professor, for having your time with us. It was my pleasure to have this video and listen to your answers about the questions.
Thank you too, and the pleasure is mine.
Thanks everyone for watching our video. And if you have further questions, different questions, you can leave your comments, your questions below the video, and so we can take reference for the next FAQ content. Stay healthy. See you on next video.
Goodbye everyone. Stay healthy.